Hi, everybody. This is Allie Orwig with the Indiana Rural Health Association. We appreciate you joining us today. Got a great presentation for you. Just a couple quick housekeeping items before we get started. We are going to have our Q&A session at the end of today's presentation, but you are free to submit your questions at any time. I'll keep an eye on those. You can either use the chat function or the Q&A function to send those questions in. You find that by hovering your mouse either at the top or bottom of the screen, depending on which view mode you're in, and an option bar will pop up or down for you. Then also, we are recording today's session. So if you are not able to join us for the full time, or if you think it's just extremely helpful and you would like to share it with a colleague or someone else in your community, we will have it on YouTube by the end of the week on our YouTube channel, which is Indiana RHA. You can also just search Indiana Rural Health Association and you'll be able to find that. But without further ado, I will go ahead and turn it over to Tina and her team.
Thanks so much, Allie. I'll share my screen. Make sure I get the right one. Okay, hopefully everyone can see that full screen of our title slide, and I'd like to welcome everybody to today's webinar. Have a happy birthday, understanding and preparing for a milestone birthday that could affect your health insurance. And this is something that we came up with, that McCafferty came up with, because we're always trying to think of different ways for people to understand how health insurance kind of ebbs and flows with their lives as we grow and age. And so we have some learning objectives for today, including we would like for you to understand when birthday milestones occur with regard to health coverage. And we'll review the steps to be taken to help consumers prepare for a smooth transition from one health coverage plan to another. We'd like you to understand how the public health emergency, or PHE, may have impacted the normal processes for enrollment, and also provide tools and resources for free consumer assistance as the PHE modifications come to an end. So as Allie said, my name is Tina Darling, and I'm the Program Director for Connecting Kids to Coverage at the Indiana Rural Health Association, and I'll be your moderator for today. And with me are my colleagues, Anne and Collette and Ben, and I'll do a brief introduction. Both Anne and Collette serve as project coordinators for the Indiana Rural Health Association's CMS-funded project Connecting Kids to Coverage Indiana. Both are Indiana Department of Insurance licensed navigators, as well as certified application counselors for the Centers for Medicare and Medicaid Services, or CMS. And what this means is that they are certified to help people apply for Marketplace. Anne has an additional certification as a State Health Insurance Assistance Program, or SHIP counselor, also coming from the Indiana Department of Insurance. And then we have our newest and best friend, Ben Hudson, who is the training director for the State Health Insurance Assistance Program. And according to Anne McCafferty, is the elite Medicare expert extraordinaire. And we're very, very happy to have you with us today as a guest, Ben. So I wanted to provide a little bit of information about our Cooperative Agreement Award from CMS. And you may hear us refer to it as a grant, and that's just because that's the world we live in, but it's a little bit different. It is just what it says, a cooperative agreement. We work in cooperation with CMS to reach the goals of this program. We are a national campaign with 39 grantees around the country, but this is the first time that the award has been given to the Indiana Rural Health Association. And we are just finishing, or we did just finish, our second year of our 3-year funding, which will end in June of 2022. And we have 4 primary program goals, and that's to raise awareness about health coverage options in the state of Indiana, to create opportunities for people to get enrolled or to complete the application and get enrolled. We very much want to motivate parents to not only get their applications for their children's coverage to begin, but also that they keep their kids enrolled from year to year. And then providing outreach guides and toolkits to organizations and individuals around the state to help their respective constituencies understand more about Indiana's health coverage programs. And here's a picture of all of us back when the pandemic started and we were wearing masks that were handmade for us by our very dear friend, Anita Brown, who's in the bottom left of the picture. We are 4 licensed Indiana insurance navigators and a data coordinator. 3 of us are certified marketplace application counselors, as I just said, both Ann and Collette are. And our goal is to provide free health insurance application assistance specifically for the Healthy Indiana Plan, Hoosier Healthwise, and Marketplace. And that free is very, very important. We are not allowed to charge for this service. We are available to anyone throughout the state of Indiana, and we don't charge a dime. Our goal is to just help people. And with the pandemic and the corresponding shutdown, we pivoted to an all virtual, HIPAA secure platform so that all of the information that we collect from our clients is 100% secure. And we are available statewide, as I said, and we are available to other organizations to do educational sessions. And it doesn't matter how small or big the audience is, we are happy to speak to everybody. And then I have to give you this disclaimer slide about our funding from CMS. We're required to do this. You can come back to it at your leisure. And with that, I'm going to have our friend Ben give us a brief overview of the SHIP program in Indiana. So Ben, I'll turn it over to you.
Yes, absolutely. And thank you again for having me today. So I'm from the Indiana State Health Insurance Assistance Program, which is a division of the Indiana Department of Insurance. And our particular division is really instructed to provide unbiased Medicare information and counseling to Indiana's Medicare beneficiaries. Although we're a division of the Department of Insurance here in Indiana, we are too actually federally funded through grants, this time through the ACL as opposed to the CMS. Nice thing about us is we have no affiliation with any insurance company at all. Our 400 volunteers that we have across the state have been specially trained by myself or other SHIP staff persons to provide this unbiased Medicare information free of charge. You can meet with one of our counselors as many times a year as you'd like, as we guide you kind of through that journey and the onboarding into Medicare.
Thanks, Ben. And with that, I'm going to turn it over to Collette Rhodes, who's going to talk to you about what happens when you have a new baby and they need health coverage. Collette.
Can you hear me?
Yes.
Okay, awesome. Okay, so hold on just a moment for me. I'm sorry.
Collette has a very busy household. She working from
Okay,
home.
sorry. Something was
little
printing out
kid.
and I didn't want it to take over.
No worries.
Okay, so I apologize. All right, so you became pregnant and you are this is a brand new stage in your life. And there's so many questions out there about what to do, what for your insurance, but that is where we are to come in and help you. So if you are already enrolled in the Medicaid program, either Hoosier Healthwise or HIP Maternity, the first thing you will want to do is you will want to go to the doctor as soon as you think you are pregnant. And then if you already have that Medicaid, your MCE, which is either CareSource, MHS, MDWise, or Anthem Blue Cross Blue Shield, can help you find a doctor that is in your network with them. You will also need to call FSSA and your MCE to let them know that you are pregnant. And if you are pregnant, when you apply, you get accepted into HIP, you automatically will be put in the HIP maternity program. You will not have a power account payment or pay co-payments while on the HIP maternity plan. And over here on the side, you will see the different services that are provided under that package A, the HIP maternity program. So you'll be able to go to your doctor's visits, dental, chiropractic, vision, and you will have your delivery as well. Next slide, please. Thank you. So congratulations, now you have had your baby and Medicaid will continue, your HIP maternity will continue for the 60 days after postpartum. And I will make a note that this will change in April of 2022. At that time, FSSA has and will extend your HIP maternity for 1 year after giving birth. But until then, it is still just 60 days after you deliver. And so what you will need to do is you will need to call FSSA to report that your pregnancy has ended and that you have given birth. And there's the 1-800 number that you can call to do that. But no need to worry that if your child is born while you are on the HIP maternity coverage, your child will automatically be enrolled into the newborn category. Now, this is if you were under traditional Medicaid, HIP, or any Hoosier HealthWise benefit package, except for package C, which is the CHIP program. If your child is born under package C, while you have package C, you will have to conduct a new application for that child. But any other program, your baby will automatically be enrolled onto your coverage. And that coverage for your newborn lasts the whole first year of their life. So the first 12 months before you will have to do a redetermination for that baby.
And Collette, could I just quickly add, this is a lot of information, which is wonderful, but this is when a licensed Indiana navigator can step in and really help you
Absolutely.
as that new mom. You've just had a baby and things are crazy, but guess what? We're here to help you. So
absolutely, yes, we will help. And if you don't feel comfortable, calling the 1-800 number and reporting that coverage, that is something that we can help you do. We can take all that off of you as you're trying to navigate that new mom world, the new baby world. We are here to help in every way. So when you do have that baby, the couple things that we will need to know to help you get the coverage for your child, or if you feel comfortable doing it on your own, what FSSA will need when you call that 1-800 number is they will just need your child's name, the sex, and the date of birth. And one way to provide this until you get that Social Security card in the mail or the birth certificate, you can always supply a birth notification to the FSSA office, and the hospital can turn that in. Us as a licensed navigator, your authorized rep can always turn that in. Your medical provider or your MCE can always do that for you as well. And then, like I said, once you receive your baby's Social Security card and their birth certificate, they will need to be turned into FSSA. So like I had stated earlier, there are 4 MCEs. There's MHS, NDYs, CareSource, and Anthem Blue Cross Blue Shield. And each of these programs have a rewards program for babies and for moms. And I highly suggest that if you do have MHS or any of these programs, that you go on and you look at what rewards you can get, because if you go to a Well Child Check, you can get money. There is different gift certificates gift cards and just different types of rewards that you can get for just going to a wellness check. So I would definitely, if you have HIP maternity, call your MCE, let them know you're pregnant, and let them know that you want to enroll in one of these rewards programs, because it's something that you would do on a regular basis is go to their 2-month checkup and you'll get a $20 gift card to Walmart. So it's just something so simple that can help you buy a pack of diapers. So yeah, definitely contact your MCEs and let them know what's going on.
okay.
Thank you, Collette.
You're welcome.
Collette, you'll notice that I jumped to 18-year-olds to 19-year-olds. Collette could probably talk for hours about what happens between 1 and 18. She's a very busy mom of beautiful kids.
and what I gave you is just a snippet of what happens. There's so much that goes into the Medicaid in that first year of life and even after. But you know, that's why we know all that information, so you guys don't have to. You know, we love helping out.
Yeah,
And seeing little babies, and seeing little babies too. That always makes it better.
And you did a great job, because that is a very busy time. And again, Navigator's really helping. We're free. So
yes,
great
absolutely.
to reach out to us during that time.
Yes.
Well, I'm going to go ahead and talk about 18 and 19-year-olds. And I kind of remember being 18 to 19, not quite as much as I used to remember, but there were things that we kind of generally know about what happens when you turn 18. And yes, I'm going to talk about 19, but just to reflect on 18. At 18, and this is kind of appropriate for the week, you can buy fireworks for the first time. At 18, you can join the military and buy a lottery ticket. You can even get a tattoo without your parents' consent. That one scared me when my own kids turned 18. Just because of needles. Did you know that there are some odd things you can do? I thought this was funny when I was looking it up. You can buy real estate, or you can even become a realtor or a notary public. Ben, how old do you have to be a SHIP volunteer?
18 years of age. Works out perfect.
Right. There's one thing you can't do at 18 though. And that is if you're currently enrolled in Indiana's healthcare program, which is called Hoosier HealthWise program. You cannot leave Hoosier HealthWise until you turn 19. So that's why we're talking about 18 to 19-year-old group as it relates to our topic today of things that could happen to your health insurance when you reach a certain milestone. So we're going to talk about that transition for those who may be currently enrolled, or if you're joining us today and you're the parent of a Hoosier HealthWise beneficiary, what are the steps you need to take to ensure that there's no lapse in that health insurance coverage leaving Hoosier HealthWise? So we're going to look at 3 options. And if you could go to the next slide, please, Tina, thank you. The first option is also another program offered by Indiana Medicaid, and it is called the Healthy Indiana Plan. I may refer to it as HIP going forward. So if you hear me say HIP, I'm referring to the Healthy Indiana Plan. This is a health insurance program offered to adults ages 19 through 64, and Indiana's Medicaid program extended an opportunity to receive low-cost health insurance to those who would not meet the eligibility requirements of traditional Medicaid. So you may have heard the term expanded Medicaid. The Healthy Indiana Plan is considered Indiana's expanded Medicaid program, as again, it expands or extends an opportunity to enroll into a low-cost health insurance program as it provides exceptions to those normal Medicaid standards. So now that we've learned that there are definite eligibility requirements associated with HIP or Healthy Indiana Plan, we know that that eligibility has to be approved. And in Indiana, it is the Division of Family Resources that handles healthcare and social services for Hoosiers, and specifically an application to enroll into the Healthy Indiana Plan has to be submitted to the Family Social Services Administration, that's a mouthful, or FSSA, which is also a mouthful. That's the agency or office that actually approves or denies your eligibility to enroll into HIP. So the first step would be to submit an application to the FSSA. There are kind of a standard set of requirements that must be met, and we're going to take a look at those on this slide. Again, ages 19 to 64, non-disabled adults. And the reason for the non-disabled adult specification is traditional Medicaid would pick up those 19 to 64-year-olds in some cases, most cases, for adults with disabilities. So that's why that distinction is made there. You must be an Indiana resident. You must be a citizen, a national, or have qualifying immigrant status. And I'm not going to get into that because that can get very complicated and detailed as well. If you have questions regarding your eligibility, this is also a great time to reach out to a navigator. We're experienced with these situations. We study, we take tests, we learn changes in legislation all the time to help you keep up with that. So we would love to hear those questions and help you along that process. As I mentioned, the expansion of opportunity to non-disabled or traditional qualifying Medicaid enrollees, there is a income level increase for those seeking Healthy Indiana Plan enrollment. And that income guideline is 138% of the FPL level. Nobody knows that by heart. I've been doing this for a long time and I look at my chart every day and I still would not wager to guess because as soon as I do, I'd be wrong. But this is a sample of, this is actually not even a sample. This is 2021's eligibility guidelines. So if you're a 19-year-old and you're working, but you're still making less than $1,482 in gross income, earned or unearned income, and gross, that means it is before taxes are taken out, because after that happens, that is gross. That's how I always remembered that. It's gross when they take out taxes. So it's gross income. This is an idea of things you'll need to know to qualify. Next slide, please. So what if you did become a realtor and you're buying real estate and you're doing quite well? Another option that you might have as a 19-year-old is to find out if your employer offers health insurance. And you can do this by reaching out to your benefits specialist at your job or maybe your HR department and find out if your job qualifies to purchase employer health benefits and what those benefits are that are being offered. Next slide, please. So you're a realtor, but you're self-contracted and you don't have a boss and you don't have a company or you're contracted. So you don't have that option of employer health insurance. A third option for a 19-year-old would be to look at perhaps a marketplace plan. So you'll see I have marketplace on the slide and HEALTHCARE.GOV. So HEALTHCARE.GOV is basically a shopping tool that is provided to Hoosiers where they can go on, apply for eligibility to purchase a plan, and then actually go in and shop for a plan right there on that HEALTHCARE.GOV website. Another feature of Marketplace and only Marketplace plans is you may be 19 and your income and your household size may qualify you for additional savings through a tax credit to help lower your monthly premium. And you may even be surprised to find out that there's some additional cost savings you qualify for, such as those that help reduce your out-of-pocket shared cost of co-pays and deductibles. One thing you'll notice in italics on this slide, to be eligible you're not applying to see whether or not you're approved for a marketplace, you're applying to see if you're approved to shop or enroll into one of those plans. So remember, you're kind of shopping. So when you apply, there are a few things that must happen. You must live in the United States. You must be a citizen, national, or a lawful resident. You can't be incarcerated at the time of your enrollment application or eligibility application. And then you'll notice in italics, if you're under the age of 26, and we'll talk about that as the next milestone, and you are claimed as a tax dependent, or you're still in your parents' household, and you qualify to be on a parent's group health insurance, or remember, group health insurance is another word for employer-sponsored insurance. If you can still be on your parents plan or a parent plan, you're under 26 and a dependent, you're not eligible for a marketplace plan. So that's a great segue into our next milestone group. So Tina, if you can advance that. You're on your own, kid. I have 20 to 30-year-old children. So I thought that was kind of funny because they want to be very grown up, but they're still my children. So 25 to 26-year-olds. This is a big time for parents because they finally have an opportunity to purchase their own health insurance. So the Affordable Care Act, as a part of that legislation, made a change to health insurance in regard to minors or dependents, and it extended the period of time a child could stay on a parent's coverage to the age of 26. Now, again, if you're independent and you're on your own and you're 26 or under, marketplace, employer health insurance, all those things we talked about before. But if you have to leave your plan, your parent's plan, simply because you've turned 26, this is another big milestone. And this is an age group I meet with a lot as an Indiana navigator. Unfortunately, health insurance is not taught in school, although that would be amazing, wouldn't it been? That'd be like our favorite class. So a lot of them have questions when they come to us. And they're a little nervous about asking those questions because, none of us like to kind of show what we don't know. So this is a big milestone. And it's very similar to that 19-year-old age. And the options are pretty much mirror each other. So I'm not going to go through them all again. But remember, those income guidelines and those eligibility requirements for Healthy Indiana Plan, you had that 19 to 64-year-old range. So at 26, you're sitting comfortably within there. You may be offered insurance through your employer. And again, you may have that option to purchase a marketplace plan. So very much the same options, but nonetheless, a very important time. What you don't want to do is run the risk of a lapse. When you got to leave your parents' plan, or you have a child that's leaving your plan, make sure you start early on this. A child losing, a young adult losing insurance at 26, most oftentimes would qualify you for a special enrollment period through your employer. You don't want to wait too long though. Most of those terminate after 60 days and of that life-changing event, such as that birthday. So you don't want to wait beyond that 60 days. I just had this conversation with my son because you're at risk of having to wait that whole period of time till your employer's open enrollment starts again. Same with Marketplace. If you leave Hoosier Healthwise at 18 to 19, or you want to look at Marketplace as a 26-year-old, make sure you take care of that within that 60-day window so you still qualify for those special enrollment periods. So now I have the pleasure of passing my part on to, oh, nope, I got one more. Oh, I love this guy too. So a quick slide I stuck in here. And again, this topic hits very close to home with me, this age range, because I'm going through this personally with my own children. They probably give me an eye roll and an oh mom if they knew I was talking about them. But I thought this was interesting, some of these statistics, because I hear them. I never go to the doctor. I never get sick. Why do I need health insurance? It's so expensive. I'm never going to use it, but I have to pay for it. Here are some things to ponder. It may be more affordable than you think relative to the big picture. A broken leg can cost $7,500 to treat uninsured. 3 days in the hospital, you're playing on that recreational softball league and you take a ball to the eye and you have to have, God forbid, some time in the hospital, that 3-day stay could cost you $30,000. That's a lot of money to come up with out of your own pocket, 26-year-old. And if you're paying for every medical service yourself, you may neglect some things that you need to do because you want to save that money. So sorry about that, Ben. I forgot I had stuck that slide in there. I really like this guy in this picture, and I had to find something that we could relate to. So now I'm gonna pass this section on to Ben Hudson. It was mentioned he is the SHIP training director. My first experience with Ben was as a student, and I hope he found me to be one of his most enthusiastic students. I think he can, because I love insurance, like Ben, we relate. And I was in a class full of people a long way away from the possibility of Medicare. However, for me and my household, we are inching in on it. So I'm sure I sat in the front row with my hand held high saying, ooh, does this come with silver sneakers? So I was really excited when Ben agreed to help us out with this portion. He is the Medicare Extraordinaire Elite. So thank you, Ben, and take it away.
All right, thank you. And you always give me the best introductions. I appreciate that. So, maybe you're a parent or maybe even a grandparent taking care of some dependent children or something like that. And we always want to keep in mind, and we can't take care of others' insurance if we don't take care of ourselves first. So I have the honor of talking about this transition from age 64 to age 65 when an individual becomes entitled or eligible for the Medicare program. So what I want to talk about first is just some basic information about Medicare. It's maybe some of you haven't heard about it before. And then we'll talk about how that's going to relate during the transition relative to some of these other types of insurance we've talked about already, like HIP and the marketplace plans. So when you first are looking into Medicare, one thing you may encounter are the 4 parts of Medicare. You'll notice as you're doing your research, there's a lot of information out there. Pretty much every insurance company and insurance agent writes articles and information on their website about Medicare, and sometimes it can be a little bit confusing, a little bit contradicting at times, and so we want to make sure we clear up some of this basic information. So there are 4 parts of Medicare. So this may be different than what you're used to with your current insurance, where it's all kind of bundled into one. But Medicare does come into really 3 main parts, which we'll discuss. Medicare Part A is what we call your hospital insurance. In a nutshell, if you ever had to be admitted to the hospital as a formal inpatient, this is the portion of your Medicare insurance that would actually provide you that semi-private room, or really that time spent within a hospital or rehab facility. After that, you'll also need to sign up for Medicare Part B. This is probably the more highly utilized portion of Medicare, and maybe at times the more expensive portion of Medicare, because this really covers everything that most of us would consider as health insurance within our health insurance. So this is going to cover you if you ever need to go as an outpatient to the emergency room. This is going to cover all of your preventative services like your flu shots and your doctor's appointments, as well as a bunch of other outpatient type of procedures and services like lab testing. I'm going to jump down to Part D. Part D is really the last piece of the puzzle, and this provides you with Medicare prescription drug insurance. So by having Part D, this is the portion of Medicare that's going to allow you to walk into CVS or Walgreens and pick up those prescriptions from your doctor. And then the last one we see here on the screen, Part C, is a synonym for Medicare Advantage Plan. And this is really what all the commercials on TV are about. Joe Namath, the retired football star, always talking about all those missed out Medicare benefits that you could be having access to. But Medicare Advantage plans are simply an alternative way to receive your Medicare. So as opposed to having the federal government act like your insurance company and pay those medical bills for you, the government actually gives these private insurance companies like Humana and United Healthcare, for instance, the ability to administer and provide your Medicare benefits for you. Next slide, please. Now, while you're looking for your Medicare choices, what can be a little bit confusing at times is understanding what you actually have available to you and what options you may have. Now, most of the time when you're researching your Medicare or talking to a SHIP counselor like myself, we'll present you with two main options, what you see in the center column under option 1 and that right-hand column under option 2. But first, I do want to talk about the left column under minimum coverage once you're eligible. So once you turn 65 years old, there actually are parts of Medicare that you must have, otherwise you may actually accumulate some sort of penalty. Probably one of the worst things about Medicare is, unlike other types of insurances where it truly is your choice per se, by not signing up for Medicare when you're eligible and not having an appropriate reason, let's say, to delay that enrollment into Medicare, there could be some associated penalties. So under this minimum coverage, once you turn 65 years old, you will have to have that Part A hospital insurance, the Part B, the medical insurance, and a Part D plan, or what we call other creditable drug insurance, meaning maybe you have drug insurance from somewhere else that's equal or better to a standard Medicare Part D plan. You're allowed to use that in its place. But at a minimum, you'll want that A, the B, and the D. As we'll talk about here in just a few minutes, this minimum coverage is really financially not the safest place to be unless you have some sort of secondary insurance to go along with it. One of the things you'll find out with Medicare is that they have no maximum out of pocket, which simply means that your share of the leftover medical bills could truly be unlimited. So the more you go to the doctor, the more you go to the hospital, more money out of your pocket with no cap on that within a calendar year. So although this minimum coverage is technically an option and is the minimum requirement to avoid penalties, financially, it's really not the safest place to be for most people, and hence why we really only present options 1 and option 2. One thing I want to talk about under this minimum coverage column, though, is the fine print. And again, as you search through Medicare, it is loaded with small print, caveats and exceptions to the rules, and these are important exceptions to make yourself aware of. The only way that you would be allowed to postpone your enrollment into Medicare at 65 years old would be if you or your spouse is actively employed or working at a company with more than 20 employees, and that's where you're receiving your health insurance from. If you work at a company less than 20 employees, it doesn't count, and you would have to sign up for Medicare, otherwise face some penalties. If you're on the Healthy Indiana plan, which we talked about earlier, again, doesn't count because it's not tied to you or your spouse actively working from that large company. So what we run into sometimes is individuals saying, I really like my insurance. I like my Medicaid, my Healthy Indiana plan, my Marketplace plan. Why do I have to get on to Medicare? And unfortunately, it's not my favorite answer to give, but it's just the way the rules are at this time. And so by not signing up, just because you like those other types of insurances, there is the potential to accumulate that penalty. Now, before we get into some of this transition stuff, I do want to talk a little bit about option 1 and option 2. Option 1 is simply having that minimum coverage, the Part A, the Part B, and the D, and then as an option, having some sort of secondary insurance to really make that minimum coverage better. So a lot of individuals will choose something called a Medicare supplement plan, which is really just a special plan made to work after the government's Medicare, and more importantly, pick up some of those remaining medical bills for you. And others may continue to qualify for Medicaid in the future, and the state of Indiana could now act as that supplement and again cover those leftover medical bills for you. Option 2, again, is these advantage plans. So instead of having the federal government act as your insurance company, where your doctors submit the bill to them, you can actually have your Medicare administered from a private insurance company. Think Humana, Anthem, United Healthcare, etc. And so this private insurance company is now in charge of providing your Part A and B benefits. They're in charge of providing your drug insurance, and maybe even will give you some additional benefits that the government's Medicare doesn't offer. Fear not, though, although the private insurance company is in charge of your Medicare benefits, they are highly regulated by the federal government and must meet some federal guidelines and regulations. All right, next slide, please. All right, so we mentioned earlier the marketplace plans. And again, a lot of people may really like their marketplace plans and say, why do I have to sign up for Medicare at 65? And why can't I keep my marketplace plan? Well, it comes down to, again, my least favorite thing to say is that's just the way it is. It's just the way the rules are really at this time. So our recommendation for when you turn 65 years old and you have a marketplace plan is to go ahead and sign up for Medicare Parts A, B, and D. At the very least, that's that minimum coverage we talked about on the last slide. And you can sign up during what's called your initial enrollment period, which is simply a 7-month window that surrounds your 65th birthday month. So what that means, if I have a birthday in November, my initial enrollment period actually goes back 3 months before that, all the way to August 1st, and then will last 3 months after that, all the way until the end of February. So it's quite a long open enrollment or initial enrollment period when you're turning 65 to make sure you are signing up for these appropriate portions of Medicare. Some individuals may actually be automatically enrolled into at least Medicare Part A and B without you having to do anything. So if you are receiving Social Security benefits of any kind, whether that's disability benefits, retirement benefits, or even spousal benefits, about 3 months before your 65th birthday month, you're going to walk out to your mailbox and you're going to find this Medicare card waiting for you, ready to be used on the first day of your 65th birthday month. And you didn't have to call Social Security or Medicare. You didn't have to fill out an application. It simply just automatically happened, all because you already had Social Security. Now, once you get yourself enrolled into at least these minimum parts of Medicare, we would encourage you to contact your marketplace plan to cancel it essentially the day before your Medicare begins. I think I say ends here, but I do mean begins on that slide. Okay. What that will do is allow for a seamless transition between the two insurances. So for example, maybe that marketplace plan ends on September 30th, so you're going to cancel it on September 30th, and maybe your Medicare is then set to begin on October 1st. So no gaps without any health insurance. At that point, once your marketplace plan has been canceled, Medicare will then be your main source of insurance moving forward. And for most people, Medicare will be your main type of insurance for the remainder of your lifetime. Now, why we have to also get you off of your marketplace plan is once you're entitled to Medicare, you will actually no longer receive the premium tax credits that may or may not are making that marketplace plan affordable for you based on your household income. The downside to that is this isn't really found out or even rectified until you file your taxes. So if you keep on your marketplace plan while you're entitled to Medicare, you may find out at tax time that you owe the federal government 6, 7, 8 months worth of subsidies or tax credits, and they're going to want that money back, unfortunately. So for one reason or another, whether it's to avoid penalties for not signing up for Medicare or to avoid owing the federal government back some premium tax credits, you will want to make sure you do get transitioned to Medicare right at 65 years old. All right, next slide, please. Now, Ann did a great job talking about the Healthy Indiana plan as well, and this is one of the biggest groups that we help as SHIP counselors is this transition from the Healthy Indiana plan to Medicare. I mentioned earlier that you may be allowed to keep your Medicaid when you qualify for Medicare, but that is in fact traditional Medicaid or what we call full Medicaid. When it comes to the Healthy Indiana plan, although it is from Medicaid, it is a different level of Medicaid, and within the rules it states that once you become eligible for Medicare, you are no longer allowed to keep your HIP insurance. So just like we talked about on the last slide, it is recommended that you do sign up for Medicare during the appropriate time, which could be that 7-month initial enrollment period, or could be if you're automatically enrolled. Our recommendation, if you're turning 65 years old and currently on HIP, is to contact FSSA about 2 months before your Medicare is supposed to start. Okay, in this case, probably the first day of your 65th birthday month, November 1st, December 1st, January 1st, etc. So 2 months before that, make that phone call to FSSA, and I believe I saw their phone number earlier in this presentation. And you're just going to want to ask to be vetted for the Medicare Savings Program. This is another version of Medicaid, okay, specifically for individuals who qualify for Medicare. And one of the nice things about it is if you qualify for the best level of this Medicare Savings Program, what we call QMB, it's going to pay for things like your Part A and B premiums for Medicare, so you won't owe a penny for that. It's going to cover all your Part A and B deductibles. and it's going to cover all your remaining co-pays and co-insurances. Simply speaking, it's going to cover every single leftover bill that Medicare doesn't pay so that you don't have to pay for it out of your pocket. And then lastly, by qualifying for the Medicare Savings Program, you'll also receive what we call extra help from Social Security. And this is what's actually going to pay for that Part D prescription insurance every month, as well as reducing those co-pays when you actually go pick those prescriptions up at the pharmacy. All right, at this time, I think we'll go ahead and turn it back to Tina.
There it goes. Hi, thank you. Wonderful information, Ben. I know I learned a lot, and like Ann, I'm one of those people who's slowly inching towards Medicare, so I paid very close attention to your slides and your presentation. Thank you. So we had just a couple of planned questions that we wanted to ask and talk about, because the public health emergency has changed a lot of the rules and has altered the environment for what we normally understood as how to get things like Medicaid and the Healthy Indiana Plan, et cetera. So questions for our panel, and I will just let any of you jump out and answer these as you feel the spirit move you, as it were. How has the public health emergency affected standard processes and normal expectations when reaching one of these age milestones? And or if someone has reached it during the public health emergency, what information do you feel would be helpful today as we move forward looking toward tomorrow? Any thoughts?
I can go first since I did the beginning of life. But more geared towards the mom and the pregnant women, you know, just normally after that 60-day postpartum period, they would, maybe their income was higher for the HIP. So, you know, then they could possibly lose their Medicaid coverage, their insurance coverage after that 60 days, or, you know, they would move back down to their HIP coverage where they would have to start making their payments to their power account. But right now, because of the public health emergency, moms who have, you know, delivered a year and a half ago are still on that HIP maternity plan because of the public health emergency. So they are not losing their coverage if they are over income for the HIP. And they're, you know, still getting those benefits of the HIP maternity plan. But once that public health emergency is lifted, just like any other age group in Medicaid, they will be asked to turn in an updated income and, you know, an updated household composition to where they could then continue to lose their coverage. So, but then just a reminder too, in May of 2022, the HIP maternity will continue for a year, not just the 60 days.
That's very true, Collette. And one point that we should make to people listening is that when FSSA requests information from people, it's usually with a very tight turnaround. And so we really encourage people to not only watch their mail, but make sure they're ready to respond to FSSA in a timely manner, because a lot of people end up dropping off and it's just because they didn't quite get to it in enough time.
Yes, exactly. Yeah. And when that public health emergency is lifted, they will be sending out notices in the mail. So if you have moved during the public health emergency, or, you know, moved here recently, make sure you give FSSA an updated address so they can send you those documents in the mail, and you will get them on time, and you will not have to worry about being dropped from your coverage.
Right. So,
and again, that's something we can help you do. We can help you change your address as well. So
that's right.
We're just here to help all around.
That's right.
Yeah, and you know, Collette did a great job of explaining how they put this moratorium on payments, and also people aren't at risk right now of losing their benefits despite the fact that they may have had changes in their income. We're certainly happy that people are retaining their coverage. That's definitely a benefit, and something we specifically as navigators, since we help people get enrolled, we're thrilled to see them stay enrolled. However, a con and a concern going forward, And in regard of what to watch for would be the fact that people may have gotten comfortable. They may have kind of even forgot their benefits are there because they just walk in to their provider's office and they hand them their insurance card and everything's fine. That could change because we don't really know. There's no prediction right now as to how it's going to look, if there'll be a return to what we called normal or a new normal. So as a part of the information I would want to express to those enrolled in an Indiana healthcare program or marketplace, two things: watch your mail. That's the big one. FSSA, and if you may remember, FSSA is the one that determines denial or termination or approval or enrollment into these Indiana healthcare programs. They will send you information that you need, and it is generally time sensitive, which means it has a due date. So it's very important to watch for that mail. So that would be my big piece of advice for Indiana healthcare program. As far as marketplace, the biggest piece of information I could relay is this is a special enrollment period based on the public health emergency through the CARE Act. Normally, there's an open enrollment period very similar to your employer's open enrollment program. They even kind of run the same November 1st to December 15th would have been the only time you could have applied for eligibility to purchase a health insurance plan. That will start as soon as, if you apply right now on the 30th of the month and make your first payment, your benefits will start the 1st of the month. So it's incredible how quickly they are getting people coverage. However, that extension of this special enrollment period has only gone to August 5th, or is scheduled to end August 15th at this point. And there's no guarantee. We don't know if that'll be extended again. So if you are considering a marketplace plan, or if you're uninsured and you do not qualify for HIP, please reach out to us. We're happy to help with that process or answer any questions. That's my third piece. I'm sorry, I'm gonna sneak one in. Third piece, when in doubt, ask, please. You know, I joke about being an insurance nerd. I'm not really an insurance nerd, but I love assisting people. And there's no question that I really wouldn't welcome. It's questions that keep us excited about what we do. And we may have heard your question, but we may not have, and we may not know. And if we don't know, we're going to find out. We're going to ask somebody that does. And that's what makes us better. So that's my last piece. So Ben, I'm sure you've got something to add.
Yes, absolutely. I'll try to keep mine quick. I imagine I'm the guy keeping us from lunchtime, like a real lunchtime right now. So generically speaking, there really has been no changes or special enrollment periods in regards to, do I have to sign up for Medicare based on COVID? So the same rules that have always applied still apply. So as we mentioned in my little section here, when you're turning 65 years old, unless you are still actively working and have that insurance from your job or your spouse's job, you really need to be signing up for Medicare. Despite how much you like the HIP or your full Medicaid, we do have to get you onto Medicare to avoid those penalties. So keep that in mind. There's been no kind of special changes to that. One problem point I do want to touch on is based on that public health emergency moratorium through Medicaid, simply stating that no one's going to be kicked off of their Medicaid or even downgraded from their current Medicaid coverage. I mentioned the transition from the Healthy Indiana plan to another type of Medicaid called the Medicare Savings Program for individuals who qualify for Medicare. Technically, that transition from HIP to the Medicare Savings Program is considered a downgrade. So it's not something that Medicaid is wanting to do to make sure that they're following the rules. The big problem with that for our Medicare beneficiaries is the Healthy Indiana plan does not pay for your premiums for Medicare, does not pay for your deductibles or your leftover medical bills like the Medicare Savings Program does. So although it sounds like it'd be nice to stay on HIP because you're allowed to, Okay? It may in fact not be the best thing to do because we really need to get you moved either to a full Medicaid or the Medicare Savings Program so we can get those Medicare premiums paid for you. So one of the things that may happen while you're transitioning during this public health emergency is if you qualify for the Medicare Savings Program at that best QMB level, you may actually be granted temporary full Medicaid coverage until the public health emergency ends. Okay, so you'll actually get the better version of Medicaid to go with your Medicare, at least for the time being. Now, if there's one thing I can encourage everyone to do, if you've reached these milestones and maybe you've somehow stayed on HIP or you are on that full Medicaid temporarily, is make sure you know what the next step is going to be. You know, educate yourself on what the transition is going to look like. That public health emergency will ultimately eventually end, and you'll want to make sure that you are on the best type of insurance to go with your Medicare at that time. That's one of the things we can assist with as SHIP counselors, is making sure that you are successfully transitioning from HIP to a version of Medicaid that can pay your Medicare premiums. And then after the public health emergency is lifted, we can make sure that you're on the best type of health insurance for you. More importantly, make sure your medical bills are being covered if they're meant to be covered.
Great. Thank you, all three of you, so much for that insight. And so we've talked a lot about how navigators can help you. This slide gives you information on where you can find a navigator, at least for Indiana Medicaid and Marketplace. So we've got Covering Kids and Families, which is a statewide organization. They have a toll-free number and a website, and they can help people statewide just like we can. And I've provided our contact information. And also elsewhere in the slides, you've seen our website URL. I encourage you to go there where you can schedule an appointment and you can find other webinars of interest. We've done some other ones pertaining to other more specific areas of health insurance coverage, like pregnancy, like immigration. And then there's Indiana's federally qualified health centers that are located throughout of Indiana. They are required to have insurance application assistance on site. And so you will frequently find licensed insurance navigators at these locations. And then there's a company called ClaimAid, and they rent themselves out, if you will, to various hospitals around the state. So you may have already been helped by a ClaimAid navigator, and that's wonderful. And then Ben, I'm going to let you talk about the SHIP information.
Yes, absolutely. So the first thing you'll see on there is the 1-800-MEDICARE number. This is the 1-800 number for the National Medicare Call Center. If you have any trouble with billing and you're on original Medicare, let's say from the government, have any problems or want to file appeals or grievances against your insurance company, that could possibly be the best place to go. Once you're on Medicare every year, you will receive a nice book called Medicare and You. This talks about all the and the basics of the Medicare program, as well as all the available plans to you in your county. www.medicare.gov is the national government website for Medicare. I call it Google for Medicare. So if you have any questions, especially on does Medicare cover this service or Medicare cover that service, that's an excellent place to go. A lot of good information and basics on Medicare. You'll see our SHIP telephone number there, the one that ends in 4800. That is our main phone number here in Indiana. That will link you to our call center in Indianapolis. And you can ask your basic questions to one of those customer service representatives. Our bread and butter at SHIP, though, really is our face-to-face or one-on-one counseling. So while you're speaking to those customer service representatives, if you would prefer to meet with one of our 400 SHIP counselors at one of our 100+ locations across the state, they can link you up with a local SHIP counselor in your area. And then lastly, you'll see our SHIP website. If you're a fan of the BMV's website or any other state website, this is our division of Department of Insurance website just for our SHIP program. We put some good basic information on there in regards to Medicare. Our phone number, as well as some additional ways to contact us, can be located there as well.
Great, thank you. And I'm not sure that we have anybody online to take questions, but we can. Or you're welcome to follow up with me after the fact at tdarling@indianarha.org. And with that, I'll turn it back over to Allie.
Yeah, we did not have any questions come in during the presentation. So I just really suggest anybody viewing the recording today, reach out to any of these fine folks. They've provided their contact information and other places where you can seek information, but certainly the navigators are a great point of contact to walk you through this sometimes complex process. But just really appreciate everybody's time today, especially Tina, Ann, Collette, and Ben. Very, very great information for all of us. So thank you all and have a good afternoon.
Thank you.
Thank you.
Bye.